Hey guys, so what I thought we'd look at today is sacro-iliac joint pain, or SIJ pain. So quick anatomy lesson first. The SIJ, or sacro-iliac joint, is created by the sacrum, which is this big section of bone of our spine, which is a very fused section. So that's the sacrum. And then we've got the ilium, which is this section of our pelvis on either side, and it's the sacro-illiac joint. So it's where these two basically meet, so we're talking here. And these, when we think about them in terms of our own body, if we feel on our lower back, there's a bony bit on either side generally that we can palpate, kind of like two little bony lumps, and that is essentially here. So that is your sacro-illiac joint area. And so sometimes people complain, oh, the bony bit's really sore, feeling a bit of strain there, perhaps one side, perhaps both. And these joints are incredibly subtle in that they don't move a great deal. In fact, there's a suggestion that they don't move at all. But certainly they can create a lot of pain, and they can be a serious point of pain, whether it's referred or if it's from that area itself. So what we're going to do is we're going to look at how we can influence sacro-iliac joint pain. So if you feel pain in that area, we're going to look at something that you can do to help it, hopefully. What we're going to do is we're going to look at how we offload the glute medius that sits along this border of our iliac crest here on the back. When this gets tight, or if it gets full of adhesions, if it gets spasmed, it has a massive influence on the position of our pelvis, on the lateral stability of our pelvis, and just the general function. And essentially, if that gets restricted, the happy symmetry and movement through our pelvis and the position of it is affected, so it may not then sit as nice and neutral as we would want it to. So if we have SIJ pain, one of the things that I often suggest to clients is to use the cross ball and to essentially target through this area on the iliac crest, which is where all the glute medius tissue and some of the glutes attach. So I'm going to show you how to do that, but essentially in terms of the skeleton, it looks like here, and then we use the ball to go through that section there. Never on the spine, okay? Not looking for any of this area, but rather trying to influence the pelvis to help it move a little bit better and give a little bit of freedom and happiness to the SIJ. So here's how you do it. What I would do is I would lie on my back, and if I wanted to target the right SIJ, I would take my right leg and I would cross it over my left. So what I'm doing there is I'm opening up, pulling some of the tissue away from that SIJ and opening up the glutes to allow me to get a little bit deeper into some of those tissues. Then I would take the ball and I would place it, if this is my SIJ here where I'm pointing, I would actually, so that's my lumpy bony bit, I would put it below that, okay, so not on the bone, but below, and I will essentially then sit myself directly on top at that point. So now I am lying straight down on top of the ball, just underneath the SIJ, into some of that glute med tissue and its attachment, and I'm just going to stay here. Now as that ball pushes into that tissue, I can start to feel a little bit of pressure, and I can just hold there. That in itself is a fantastic way of giving some release to this area. What we're essentially doing, to use my skeleton friend here, is putting the ball into the sacrum, just underneath the SIJ here, which actually creates a really nice distraction. Okay, so it's a really nice distraction. Can you see that okay? Yeah. So it's into just below the SIJ joint, and it creates a little bit of gravity-assisted pressure straight into this tissue. And then what I'm going to show you now is how you actually start to work across. But that in itself is a very effective technique, okay, even without any movement, and that's enough for some people because it can be very sore. So let me just show you again. So from targeting right side, cross leg over, ball goes where the bony bit is and then just under, and that's where you load your body weight onto it, like so. That in itself, very effective. If I wanted to start working around into the glute med a little bit more and into the fleshy section on the edge of the iliac crest, all I do is tilt my pelvis. So I'm now rolling, there's a good bit like that. It's quite subtle. I'm just turning my hips so that ball is now coming a little bit more onto the outside. And again, when I find an area that hurts, I just hold. and then I might roll again. So I'm now essentially rolling along the edge of the band of my shorts, really. Okay, not into the back, not into the kind of above the bony bit, but rather below and along the edge of our pelvis. Once you find a few areas that hurt, and you've held for 30 to 60 seconds, that'll do nicely. And that should give you a little bit more of a feeling of relaxation and looseness around there. If you find that that is too uncomfortable, if you've got SIJ pain, then simply leave the leg there and do exactly the same thing with both legs in the same place. Still effective, but the ideal is to have that leg crossed over, because you're just going to achieve a little bit more. Try that, see how you get on. Thanks.